So, today I'm going to be talking about gastroparesis, which is a gastrointestinal disorder that affects the motility of your stomach. Disclaimer, I'm not a medical professional and this is not medical advice. Gastroparesis literally means stomach paralysis. It affects the vagus nerve and the muscles of the stomach, causing the automatic contractions that help food to digest slow down. This makes it take longer for food to pass through the stomach and into the intestines. When I was 14, I started to experience mild nausea every time I ate and would have acid reflux every time I lay down, especially if I laid down soon after eating. Over time, however, my symptoms became more and more severe until I couldn't even keep water down, no matter what we tried. All of this was because when your digestion is slowed, the food you eat sits in your stomach for too long, and that can cause a variety of symptoms. My main symptoms are nausea, vomiting, acid reflux, bloating, and low appetite. And while this is my experience, everyone can have a different combination of symptoms. Nausea is the hallmark symptom of gastroparesis. However, other symptoms can include vomiting, regurgitation, acid reflux, bloating, abdominal pain, low appetite, difficulty controlling blood sugar, and malnutrition. Everyone has some combination of these symptoms, and everyone's symptoms are different. The type of gastroparesis I have is called idiopathic gastroparesis. Idiopathic means that there's actually no identifiable cause of the gastroparesis. However, doctors and scientists believe that it's because of some sort of dysfunction of the vagus nerve. Other causes include things like diabetes, surgeries on the stomach, viral infections, and metabolic disorders like hypothyroidism. Because my gastroparesis was getting worse quite fast, I did the diagnostic tests a bit out of order to how they're usually done. Typically, the first line of testing is done to rule out mechanical causes of your slow digestion. This can include tests like an endoscopy, a CT scan, and an MRI to get a visualization of your digestive system, especially your esophagus and your stomach. Sometimes gastric motility can be slowed due to things like ulcers or a narrowing of the pylorus, which is the end of the lower part of your stomach that connects your stomach to your intestines. Then, once a mechanical cause of the symptoms is ruled out, there are three main tests to diagnose gastroparesis. The first is called a gastric emptying study. During this test, you eat a small meal, usually consisting of things like a glass of water, a slice of toast, and some eggs, which contains a slightly radioactive isotope. And then, for every hour over 4 hours, you get taken for an X-ray. The isotope allows the food to be seen on the X-ray, so it can be monitored as it's passing through your esophagus and stomach. Another common test is the Smart Pill Motility Capsule. In this test, you swallow a small capsule which submits data to your doctors about how fast the capsule is traveling through your digestive tract. Finally, there's the Gastric Motility Breath Test, which is where you eat a small meal that contains carbon-13, a carbon molecule that produces gas that can be measured when it reaches your small intestine. Because it was taking so long for me to get in to see a gastroenterologist to do all of this testing, my primary care provider ended up just giving me a referral for a gastric emptying study, which confirmed that I most likely had gastroparesis. Once I was seeing a GI doctor, we decided that I would try a liquid diet and see if I could work my way back up to solid foods. However, this in combination with some medications that we tried was not adequately working, and it progressed to the point where we needed to absolutely confirm there was nothing mechanical happening. So I scheduled for an urgent endoscopy which ruled out any mechanical causes of my symptoms. This meant that we were able to move on to more invasive types of treatments. Treatment of gastroparesis can be quite varied. The first step is usually lifestyle changes. A lot of things can affect how quickly your stomach digests food, and when you have gastroparesis, it's even more important to be aware of those things. For example, laying down causes your stomach to digest more slowly, as well as sleeping. So, some lifestyle changes that are suggested for people with gastroparesis are sitting up during eating and remaining sitting or standing upright for at least an hour after eating. not eating too close to going to sleep, as well as eating smaller, more frequent meals in order to lessen the amount of food your stomach has to digest at a time. Another thing is some dietary changes, which include lessening fat and fiber intake, as those are harder to digest than other things. Often, lifestyle changes are accompanied by medications, the most common being things like Reglan or erythromycin, which stimulate the muscles of the stomach to help with your stomach contract at the appropriate times, as well as antiemetics like Zofran to help control nausea and vomiting. When gastroparesis has a known cause, there may also be medications added on that treat that root cause rather than the symptoms of the gastroparesis itself. Sometimes, lifestyle changes and medications aren't enough to adequately manage your symptoms. If that's the case, the next step is often surgical treatments or more extreme types of treatment. There are a fair amount of options out there, but I'm only really familiar with a few of them. Sometimes there can be things like resecting the stomach or removing part of the stomach, but I'm not knowledgeable enough about those to speak on them and how they work. One of the more popular surgical treatments is called a gastric pacemaker, which functions like a cardiac pacemaker but for your stomach, where a device is implanted into your abdomen and helps control the electrical signals that the vagus nerve is giving out in order to stimulate the contractions of your stomach at the proper times. Another surgical option, which I actually have a friend who is doing quite well with after getting this surgery, is called a pyloroplasty. This is where the pylorus, that lower part of your stomach, is surgically widened to let more food through at a time, so that even if your stomach isn't working properly, mechanically, more food has to pass through your stomach and into your intestines. The last one is one I'm very familiar with, which is a feeding tube. Now, a feeding tube doesn't have to be surgically placed, but in gastroparesis, as this is more commonly a long-term treatment option, it does usually end up as a surgically placed feeding tube. What you start out with is called an NJ tube, usually, which is a nasojejunal tube, which goes from your nose, it's inserted through your nose, down your throat, and into your jejunum, which is a part of the small intestine. The surgically placed kinds, there are two main kinds of surgical J tubes, which are GJ tubes, or gastrojejunal tubes, which is what I have, which are inserted through your skin and stomach wall, and then there's a tail that goes from your stomach into your small intestine. A straight J tube is inserted directly into your intestine and doesn't have an opening for the stomach at all. Using a feeding tube, you use specialized formula that you put through the tube and into your intestines in order to bypass the stomach completely. When my gastroparesis symptoms started getting worse, I tried a lot of different lifestyle changes. I tried the liquid diet, and I tried several combinations of medications, which slowed the progression of my symptoms for a while, but ultimately I ended up needing to get a feeding tube because I was losing too much weight, I wasn't getting enough nutrition, it was bad enough that nothing was working, and I don't regret that decision at all. My feeding tube has saved my life at this point. The process of getting a diagnosis and treatment was a bit excruciating and took quite some time. Living with gastroparesis can severely impact your quality of life, which means that prompt treatment can be very important. Unfortunately, diagnosis and treatment is usually delayed by months, if not years. I started having symptoms of gastroparesis when I was 14. I am now 21, and I only got diagnosed and started getting treated when I was 20, less than a year ago. I was fortunate enough to be taken seriously by my doctors when I brought up my concerns this past year, in large part because I am privileged, I am white, I am thin, which does a lot in the medical world. For people of color, especially women of color, and people who are overweight, it is much, much harder to get the care you need, especially in terms of gastroparesis, where doctors have this vision of someone who is skinny and malnourished as the only person who can have gastroparesis. This is absolutely not the case. Anyone can have the symptoms of gastroparesis, no matter their weight, their body type, whatever. Anyone, including people who are overweight, can become malnourished, and everyone deserves treatment, and everyone deserves prompt treatment, especially. No matter how severe your symptoms are, you deserve to be taken seriously and live comfortably. And no matter your body type, you deserve to receive the treatments that help you the most, no matter how extreme they are. If lifestyle changes are enough to manage your symptoms, that's awesome, and your experiences with gastroparesis are completely valid. All that matters is finding the right combination of treatments that work for you and your body. That's all I have for you today. I hope you've learned a little bit about gastroparesis and that you're having a good day or night wherever you are. I will see you next time. Bye!